Back in our Health Watch today, we may know Botox best as a wrinkle filler and skin smoother, but perhaps you've noticed that Botox is also being marketed as a treatment for migraines, bladder problems, and even more. Take a look at this ad.
Botox is an FDA-approved treatment that significantly reduces headache days for adults with chronic migraine. 15 or more headache days a month, each lasting 4 hours or more. It's proven to actually prevent headache days, and it's injected by a doctor once every 3 months.
Okay, so you may be wondering, how did Botox go from a cosmetic procedure to a treatment for serious medical conditions? Dr. Sanjay Jain joins us. He is a board-certified physician in integrative medicine and author of Optimal Living 360. Good morning, doctor.
Good morning. How are you doing today?
I'm doing great. I'm migraine-free, thankfully. But it's amazing to me that Botox is now being marketed in that way. Does this really work? Why are they promoting it this way?
You know, it was actually discovered by accident. When people were getting injections in their forehead for cosmetic reasons, they found that their migraines are going away. So it actually was discovered by accident. So this has been found and researched a little bit further, and it has discovered that it actually helped migraines.
And it also helps with overactive bladder as well.
Yeah, so actually we have two treatments for Botox, and everybody knows about the cosmetic treatments, but people don't really know the medical treatments. So we mentioned migraines. It can actually treat overactive bladders, people who have a hard time controlling their bladder, frequency, urge to urinate. So it actually helps treat that. Other treatments include excessive sweating under the armpit. I think that's a very common treatment. People also don't know about spasms in their eyelids, cross-eyedness, and spasticity in their arms.
Let's go back to the, we were talking about the overactive bladder real quick. I know we had some information to put up on the screen as to, these are really kind of your last resort things.
Yes.
I mean, there's medication you should always go to first off, you said. This is if nothing else works. But describe how this kind of works for an overactive bladder, what the procedure would be like.
It's not pretty. So definitely try medication. That's first line. But for them to treat overactive bladders, you have to actually get a urologist, take a cystoscope or a camera into your urethra and into your bladder and do multiple small injections to your bladder wall. It's about 1 centimeter apart, about 20. That's a lot of injections. So there could be some mild side effects. Some of the side effects could be urinary tract infections. You can have pain when you urinate. And sometimes it could be, you can have urinary retention, so you have a hard time. Actually, it could be the opposite, where you can't really excrete your urine.
Let's talk a little bit about the migraines and how that works. Now, I know you were going to kind of show me here, using my head as the dummy, where it is you would use that as a treatment.
Right,
and how many different injections do you get?
Well, you're going to have the most famous forehead this morning in D.C.
Oh, wow, okay.
And right now, they usually do one injection in the center, right in the forehead. And these are a group of muscles here in the forehead. So there's 2 injections on both sides. They're the corrugator muscles up here and up here. Then you get the frontalis muscles up here. So about 2 injections here and here. So they're not dermal injections. They're actually a little more deeper into their muscles. So you got a group of muscles up here. Then you got your temporalis muscles on the side. So they do about 4 injections on the side. And so there are also going to be some injections in the back of your head.
Oh, wow.
They're occipital muscles, so right in the base of your head in the back, and also up high in the neck. So it really depends on your symptoms and where your doctor is going to want to inject.
Now, and I know we have the information on the screen there as well. Feels like a pinprick. People think about these things with needles that it's going to be painful. It's not really that painful, is it?
It's like a little bee sting, a little prick. After that, you're not going to really feel the pain, but there could be some little bit residual pain afterwards. So some of the side effects could be a little bit of facial paralysis. You could have a little bit of localized pain, but those are usually the most common side effects.
And here's the thing, and it mentioned it in the ad too, this isn't a one-time thing. You got to do this every 3 months, which is basically what you have to do with the cosmetic procedure as well with Botox, right?
Sure. So it's really the same cycle in terms of going back and getting treatment. But one thing that the ad mentioned earlier is that to be treated for migraines, you have to go through certain criteria. As we mentioned before, go through medication. That's your first line. Then to fit that criteria for Botox, 15 days a month and it has to last for 4 hours. These
Migraine.
migraines. Absolutely.
You have to be having 15 a month, and they have to last more than 4.
Yes.
You've got that. I feel really bad for you, you know, if that's the case.
Absolutely.
So, but as you mentioned, try the other, you know, remedies first or medication and see if that works.
Yeah, medication's first line. If it's failed medication, then you can move on to this.
Okay. All right. Dr. Sanjay Jain, thank you so much for coming in and talking about it, kind of giving us both sides of the coin on this, so we appreciate it.
Thank you very much.
Steve and Allison, back to you.